Hello, Facebook. I am Dr. Myla Bennett of Adair Plastic Surgery and Medical Spa in Johns Creek, Georgia. I'm just sharing the video to my other pages. All right, that's done. So it's been a long time since I've been on. It's been over a month. It's been a long time. I don't know if I even went on at all in December. Hi, Christian. For those of you who are on with me, if you can go ahead and share the video, that will be wonderful. This message tonight is one that I like to do at the beginning of the year. Every year, just because we're entering into the most busy time of year for plastic surgery. And I just want women to be safe. There have been several deaths in the last 5 or 6 weeks, several in all different places. And so this is not a video to target one place in particular, but more importantly, I'm going to be targeting unsafe practices. So things that are red flags that can help you say, maybe I shouldn't go here. Because at the end of the day, you only have one life, you only have one body, and if you choose wrong, it could be, a life or death situation. So it's really tricky. Sometimes I can't even tell. Some of the people who are creating plastic surgery practices who are not plastic surgeons have gotten really keen and slick and cunning at deceiving people. That's one problem. The other problem is that some women, they actually know and they just blow it off for different reasons. One big reason why people blow off the knowledge that they have is the price. Another big reason that people blow off the knowledge that they have is because they want a very specific type of plastic surgery, and that person, the good pictures that they see is exactly what it is that they want, so they're willing to risk it all for getting this body. And so there's different reasons, but for the people who are, thank you, Edna, for the people who are appropriately concerned for their safety and well-being, this video is for you. I want to start off for people who want to stay stateside and get plastic surgery. I want to start off by talking about some of the tricks that U.S. doctors do to deceive you into believing that they are a plastic surgeon when they in fact are not. So one of the big topics is cosmetic surgeon versus plastic surgeon. And to the layperson, that sounds like the same thing, but actually it really isn't. So technically I'm a cosmetic surgeon, but I would never call myself that because I do 99%, my practice is like 99% cosmetic. I call myself a plastic surgeon because I am plastic and reconstructive surgery trained, meaning after medical school, I did a residency in plastic and reconstructive surgery, which that residency consists of a portion of general surgery and then all the subgroups of plastic surgery. So plastic surgery is an umbrella term for lots of different things that we do, and reconstruction is the majority of plastic surgery. Cosmetic plastic surgery or aesthetic surgery is a small subset of the big field of plastic surgery. And in our residency training, we learn all of the things that go under the plastic surgery umbrella. So that is facial trauma, that's cancer reconstructions, that is birth defects and cosmetic surgery. All those things are in that subgroup. All those things fall under the big umbrella of plastic surgery. We spend For me, my plastic surgery residency was 5 years. So I spent 5 years learning learning general surgery and all those areas of plastic surgery. And then since I knew that I wanted a primarily cosmetic practice, I did further unrequired training, an additional year in aesthetic surgery, which is the cosmetic part of plastic surgery. So I am trained to do anything from a hernia repair all the way up to like a facelift or a tummy tuck or whatever. I can do all that. I can do cancer reconstruction. I can do, I can do all that stuff. A cosmetic surgeon, the way people usually use that term, it's usually a phrase that's used to deceive, because plastic surgeons tend to just call themselves plastic surgeons, because when a person hears plastic surgeon, they hear cosmetic surgeon at the same time. Most people assume if you're a plastic surgeon, you do cosmetic surgery, which is not the case. A large percentage of plastic surgeons don't do any cosmetic surgery. There's a large, I would say more of the plastic surgeons out there do mostly reconstructive surgery. So then you'll get these people who finish all types of residencies, surgical and non-surgical, and the ones who seem to be making the most noise are the ones who have no formal surgical training at all. And they start calling themselves cosmetic surgeons because it confuses people. And they'll even go like, you can become a board certified cosmetic surgeon from any specialty. It doesn't matter if you're good or bad. You can just kind of pay to get in. It's not really based on best practices. It's not based on training and like the foundational principles of plastic surgery. They don't even know that stuff. And so people think, oh, it's just like, a little nip and tuck, but there is science behind all of it. And when you nip too much stuff away in one area or do it on a person who's not appropriate for it, you end up with really bad disasters in the form of really horrific complications, or in the worst case scenario, death. So, and the cosmetic surgeons have gone to great lengths to actually make it appear that they are more qualified to do plastic surgery than the plastic surgeons are, which is absurd. But to a lay person who doesn't understand, people using these different marketing tactics to trick you into believing that they are who they are not is dangerous. And so that's why I'm here. So I tell people, when you are, first of all, if you see, if a doctor is calling themselves a cosmetic surgeon or a cosmetic physician or something like that, or they say, or you see board certified physician on a page where they're representing themselves as having a plastic surgery practice, if this says board certified physician, chances are they're not a plastic surgeon. They're probably not even really a surgeon, because people are just kind of looking for the word board certified. And if they were a board certified plastic surgeon, they would simply say that, like I do, board certified plastic surgeon. I wouldn't say I'm a board certified physician or whatever. I wouldn't say that, because I would want people to know exactly what I am. A lot of times too, on those, the doctors who aren't really real plastic surgeons, on their websites, it's hard to find it's hard to find the history of their training. So most doctors love to brag on their training. I went to so-and-so and I did my residency at so-and-so and I did my fellowship at so-and-so and I da-da-da. And when you look on their page and there is no sign of their history of training and it's a plastic surgery site, run. They are not a plastic surgeon, because why would they hide that? That's a selling point. People want to see, where people have trained. And then if you're reading their page and it says that their residency training was in emergency medicine, or their residency training was in family practice, or their residency training was in obstetrics and gynecology, or their residency training was in dermatology, that is not a plastic surgeon, even if they're calling themselves a cosmetic surgeon. And you need to be extremely, I wouldn't get plastic surgery from any of those places. I would not do that. I would not get that. I would not allow a doctor with that type of training to do my plastic surgery. Wouldn't do it. So pay attention to that. And sometimes people think, oh, they're a board certified emergency medicine doctor, so if there's an emergency, then they can fix it. So emergency medicine doctors are extremely necessary, and I'm grateful for them when I have an emergency or my kids have an emergency and I need an emergency medicine doctor. But if you are, let's say you're a trauma and you go to you're rushed to the ER, to the trauma bay. In that trauma bay, you're going to have the emergency medicine doctors, and you're also going to have trauma surgeons, because if the person has something going on that requires a surgery, the ER doctor stays in the ER and the patient goes up to the OR with the surgeon. An ER doctor is not a surgeon. They don't do surgery. They don't even rotate. Well, at least where I trained, they didn't even rotate through surgery at all in their training. So they're not. So if you have a surgical emergency, an ER doctor is not who you want to be there. They're not going to. It's just like if you have a heart attack, you don't want me. Like you don't want me. I mean, I remember stuff from med school, and if I'm the only person there, I'm going to help. But if somebody who does that all the time is there, they're way more appropriate. You know, I'm going to know more than a person about somebody having a heart attack. I'm going to know more than a person who has no medical training, but I'm certainly not going to know more than a person who deals with that all the time. And if one of those people shows up, I'm stepping aside and I will assist them in what they say. So you want a doctor, you want a surgeon who is trained formally in what it is that you're trying to get. And so the first step that you should take as far as plastic surgery in America, I don't know how to look up credentials and stuff like that in other countries because every country is different. But in the United States, the first step you should take when you're considering a particular doctor for plastic surgery is to go to the American Board of Plastic Surgeons website and type their name in. And if they're not there, then pick another one. Go to the next person on your list. That is where you start. See if they're at least a plastic surgeon for real. Once you figure out if they're a real plastic surgeon, then you can start taking it a step further. Because with that being said, if you're trying to get, liposuction or especially liposuction or a tummy tuck but really liposuction, it seems people really underestimate lipo. If you get a doctor who doesn't normally do liposuction to do your liposuction, especially if you're like really thin or with thin people who have like a small trouble area who get liposuction, they're the easiest to disfigure because there's no room for error. Like you have to have finesse and skill with people like that, or you will disfigure them forever, right? So you want to get a plastic surgeon that actually does cosmetic plastic surgery pretty regularly. During my training, we didn't get to do a ton of cosmetic surgery. We did some, but in my fellowship, I did a lot. Like that's all I did. In my fellowship, it was a full year of me doing only cosmetic plastic surgery. That's it. Well, I took call in the hospital for like trauma and stuff like that. So unless it came from when I was on trauma call, pretty much all I did during that year was cosmetic plastic surgery. It's different. So in general plastic surgery, we are looking to restore form and function. In cosmetic plastic surgery, form and function are already there and just fine. So we're taking a normal person and trying to make them better. Whereas in reconstruction, we're taking a person who is disfigured, whether it is a disfigurement that they're born with or one that's acquired from cancer or trauma or whatever, and trying to make them be normal again and function in a normal way. So the aesthetic of it is not quite as crucial as it is when you're taking a totally normal person and trying to modify something. So once you figure out if the person is a plastic surgeon, then the next thing you want to do is figure out if they are actually a plastic surgeon who regularly does cosmetic plastic surgery. That is important. Just because somebody's a plastic surgeon doesn't mean they're going to do a good job. So you have to go beyond, okay, yes, this is a plastic surgeon, and go to, okay, now does this person do cosmetic plastic surgery? And then once you figure that out, take a step further and say, does this person do what I am looking for? If you're looking for normal stuff. Now, sometimes people come in and ask for things that are a little off the wall. And that's one of the fun parts of what we do as plastic surgeons. We learn all these different techniques and tricks, and then we have to know when to pull them out of our hat to do what it is that our patient needs or wants us to do. So not every single thing that I do every day is something that I do all the time, but most of the things that I do is things that I do on a pretty regular basis. And if it's something that I'm like, I'm not sure if I should do that, I'll send them to somebody who I know can. I have no problem doing that, because at the end of the day, what I want is for you to be happy, for you to have a good outcome, for you to be complication free, and for you to be alive. So be careful with, if you hear if you hear cosmetic surgeon, dig deeper and verify that it is a real plastic surgeon. You want a real plastic surgeon, not an ER doctor, not a family practitioner, not a dermatologist, not an OBGYN, not a general surgeon, unless the general surgeon did a plastic surgery fellowship. That's different. You want to make sure the person you have is qualified and capable of doing a good job in what it is that you're asking for. I've had a few people this year who had to get hysterectomies, and their OBGYN was like, I'll do your tummy tuck. And they're like, oh, I can get it all at the same time. And the OBGYN, it was 2 different OBGYNs, both in Atlanta. I mean, jack those ladies up. One of them is suing the OBGYN. It's like, it's crazy. I'm not going to be like, oh, yeah, girl, I can do your tummy tuck and I can take out your uterus at the same time. I'm not taking out nobody's uterus. In fact, on this week, I'm doing a combo case. The OBGYN is taking out their uterus. I'm going to do the tummy tuck. Like, she's in her lane. I'm in my lane. Like, you don't want that. That's not the right thing. The person taking out your uterus should not be the same person that's doing your tummy tuck. It's highly unlikely that they're trained in both. Highly, highly, highly unlikely. And as far as like the surgeries that are in what we call the subcutaneous space or above the muscle, the big thing is blood supply and the understanding the intricate anatomy of the blood supply. Because if you do things the wrong way, cut in the wrong places, you will end up with a bunch of dead tissue. And there's plenty of pictures floating around on Facebook of women with what's called necrosis after someone overdid it or cut into areas they shouldn't have, considering that they cut into these areas. You know, there's actually a method to the madness, and people completely underestimate that. And so that's why it's so important for you to get someone who is really plastic surgery trained, because the whole time, all those years of my training, blood supply and where, you know, the vessels are coming from and where the nerves are coming from, what muscle they penetrate through, and whether they're on the undersurface or above them, all of that stuff, they're drilling it into our heads constantly. Other doctors aren't getting that. That's just not a part of their training. It's not necessary for what they do. It's necessary for what we do. So that's why it's so important to have a real plastic surgeon. Now, another subtle thing that most people don't recognize that's different between plastic surgeons and other types of doctors is that we are one of the few specialties, and I'm trying to think of any other ones that are like that, and I can't really think of any, that is actually negligent to do surgery, do an elective procedure on a person who is not in good medical condition. If you go into your family practice doctor and you have high blood pressure, and your high blood pressure is a result of your weight and the fact that you smoke, your family practice doctor is not going to tell you, I'm not going to treat your high blood pressure until you lose this weight or stop smoking. In fact, it's negligent to do that. They're supposed to treat you. Even if it is things that you can do from a diet and behavioral standpoint to improve your condition, they still treat it. However, with plastic surgery, if you have brittle diabetes and a hemoglobin A1C of 12 and you smoke cigarettes and you got a BMI of 45 and I do a tummy tuck on you and something happens to you, I'm getting raked over the coals. That's completely inappropriate. So we are trained on who to say no to and what circumstances we say no. And that is very different than every other type of doctor. So when you get these other specialties deciding that they're going to dabble in plastic surgery so they can make the extra cash, they don't even understand the selection process to choose safely. They don't even understand that. That's a subtlety that really makes us different than other groups. I've gotten people to quit smoking because they want the surgery. I've gotten people to lose weight because they want the surgery. Where other doctors fail miserably trying to get them to lose weight or stop smoking because, they're going to treat them for whatever it is they're coming to them for regardless. That's not how it works in plastic surgery. If you're chain smoking cigarettes, you're not getting a tummy tuck. In fact, if you are chain smoking cigarettes, a lot of plastic surgeons won't even do reconstruction, like breast reconstruction or something like that. They won't even do that because the complications goes up dramatically. Right. If your iron is low, your hemoglobin is low, I'm not doing it. But if you need a heart surgery and your hemoglobin is low, then we're going to transfusion, And good point. So then that brings me to some of these other jokers who are out here routinely transfusing everybody because they're doing so much surgery that, they're surgerizing people within an inch of their life. And the women will leave the surgery center practically half dead and getting blood transfusions in third world countries and all this kind of stuff. Even in the U.S., blood transfusions are not without risk. I say, why are we operating on a person whose blood levels are low, or if they're not low, why am I operating on them until their blood levels are low? That is doing too much in a healthy person who doesn't need it. You shouldn't be taking somebody to the brink like that. That's inappropriate. We were trained not to do that, except some people have lost sight of that and they just want the money. Somebody just mentioned the cell savers. Cell savers, I don't use cell savers because I'm not, once again, going to do so much surgery on a person that they need blood back. Not on purpose. Now, if during the surgery something goes left and a person needs to be transfused, I would do that, even though I haven't had to do that. But you shouldn't be planning to lose that much blood because that's how people die. So when you see some of these ladies dying, they're like, oh, she died from cardiac arrest. That's the definition of death, is cardiac arrest. Cardiac arrest means heart stops. That's what means you're dead. A lot of times what has happened in those situations, if it's not a fat embolism, it is loss of too much blood. Like, not having enough blood is not compatible with life. That's called exsanguination. No one should be doing so much surgery on you on purpose, planning to give you a blood transfusion because they're planning to do that much surgery on you. When people are trying to get 5 and 6 procedures at once that are all like removing a lot of tissue, think about it. If I go and remove the skin on the skin and fat on the bottom of your belly with a tummy tuck, and you are a heavier person, let's say that tissue is like 10 pounds. Guess what? In that 10 pounds is blood vessels with blood in it still. So every piece of tissue that's removed from your body has blood in it. You're losing blood in the tissue, plus you're losing blood that happens during the surgery. And so you're going to removing chunks of tissue from all over the place and they all have blood in it. That's not a good plan. That's not good. Liposuction. Liposuction is a bloody procedure. If you think about it, we're using teeny tiny incisions and operating in a big surface area through these teeny tiny incisions, and we can't see. So when blood vessels get broken with the liposuction cannula, we can't stop it because we can't see it. Then you get these people saying, oh, after your liposuction, the liposuction causes faja burns, and so don't wear the garment. Well, the garment helps stop the bleeding. So if if you have a cut or something on your hand and it's bleeding, you put pressure on it. You hold pressure on it long enough, it'll stop. The compression from the garment after surgery actually helps control the bleeding. So if you get lipo and just sitting there flapping loose free and you got aggressive liposuction, you're just bleeding under your skin. You can die like that. So you need a person who is ethical, who is well trained to even be able to make those decisions and understand those nuances in order to keep you safe. So you don't want to be like cutting all these corners trying to save a buck or going somewhere crazy because they can make your waist the smallest. Because it doesn't matter if your waist is super small and you got the biggest butt out there. If you're dead, it doesn't matter. Safety is the most important thing. So when people are like, do you use a cell saver? Running around asking folks do they use a cell saver is basically running around asking them, are you willing to take me to the verge of death? That's what you're saying. Some of the questions people ask are death trap questions. Do you do aggressive lipo? Can I get all my procedures at once? Well, it depends on how many procedures you're talking about. Depends. Yeah, you don't want to be cutting corners like that with your one and only life, and your one and only body. A big example of that. So there's a lot of surgeons, and it's technically not wrong, that will do liposuction on your central abdomen and a tummy tuck at the same time. I personally won't do it. So I have a lot of ladies, I'm like, all right, you need both. Because a lot of women do need both that present to me. And I'm like, look, for most people, we'll do the liposuction first, wait 3 months, and then I'll do the tummy tuck. And for a percentage of those people, the skin will shrink better than I anticipated, and they won't need the tummy tuck. And they're like, I'm good. And so they're done with one surgery. And then the rest of those ladies, the plan from the beginning is for them to get liposuction. 3 months later, we get the tummy tuck. And guess what? I have 0 instances of necrosis. None. No one gets necrosis in my office. Like, I have had none. The last time I saw necrosis was in training when I used to do recon, and we had to operate on smokers and everybody. And that's, that was the only times that I saw things like that during my training. But since I've been in practice doing, private practice, cosmetic plastic surgery, I have had 0. None. I don't take those kind of chances. So there's a percentage of the women who get that combination, who get the tummy tuck and the lipo at the same time because they're trying to save themselves a surgery. And if the skin on your whole belly dies, you're going to end up with more than one more surgery. And you're also going to end up with a big scarred up abdomen forever. So we can do it the right way, be patient, and do it the safest way to reduce your complication profile. Or you could be like, well, so-and-so did it and she was fine. Yep, she was fine. And then if you're not, you're not. Because everybody's not the same. But one fact is that the doctors who combine those procedures, a percentage of their patients have dead abdomens. Period. That's just a fact. So, really you want to go to places that you are treated like a person, not a number, not a case, not just another case. I think there's some of these places out there that are doing 10 cases a day of big old mommy makeovers or Brazilian butt lifts, and it's physically not possible for one person to do that many of a big surgery like that in one day. So then you have to be, so you're thinking, oh, they're really good, they're really busy, but you should be thinking, how the hell is this one person gonna do this many big surgeries in one day? That's what you should be thinking. So then you should be wondering who's doing it, because it is not uncommon for you to think one person's doing your surgery and they might not even be there. They might not even be in the building, and some tech is doing your operation. But you got it for cheap. And the person had 200,000 followers on Instagram, so they must be good, right? Which brings me to my next point. You can't determine the quality of a surgeon based on the number of followers they have. Can't do that. The people, in fact, some of the people who have the most followers, like there's one doctor who has millions of followers, and he has done he doesn't do surgery though, but he's got millions of followers, and he has treated the faces of some of the most famous people in the world, and everybody knows this person's name, And this cat is not trained in anything. He literally didn't do any residency at all. And I have had people in my office, celebrities, who went to him and got jacked up, or went to him and thought they were getting one thing and got something totally different. He's super expensive, completely unethical, and trained in absolutely nothing. He has his medical license. He graduated medical school, but he got no training in anything, and everybody's running around thinking he's a dermatologist. He ain't no damn dermatologist. Dermatology is really competitive to get into. Becoming a dermatologist is not easy. So it's kind of like in the hierarchy of medicine, it's almost like a status symbol. When you say, oh, I'm derm, people are like, oh, they're smart, cream of the crop. Plastics, oh, they're smart, cream of the crop. This joker did nothing. And if he knew he wanted to be a dermatologist, why didn't he just do a derm residency? Maybe because he couldn't get in one. Meanwhile, at the ranch, he's charging people buku crazy amounts of money, pretending like he's messing some folks up. Because I know for a fact he is, because some of them ended up in my office trying to get me to fix it. So you got to be careful. When people say do your research, I'm trying to help you know how to actually do the research. No doctor, none of us are going to put up the bad pictures. So just because they got a page full of good before and after pictures, that doesn't mean that they haven't killed people. That doesn't mean that they don't have a whole boatload of people in litigation. That doesn't mean that they don't have a whole boatload of people with horrific complications. They're not going to tell you that. No one in their right mind would when they're trying to run a business. So you got to think about that stuff. Some of the best surgeons out there aren't even on social media. They're too busy doing good surgery and taking good care of their patients. Right. So I wasn't really paying attention to the comments, so I'm going to scroll back and look a little bit. Oh gosh. Okay, Cynthia Noble, have you heard anything I said, honey? I hope this question was at the beginning. Let me read it for the people on YouTube when I share this. Cynthia Noble asks, do you think it's okay to have a doctor that removes a gallbladder to do liposuction and tummy tucks? No. It's okay to have them remove your gallbladder. You didn't hear nothing I said, lady. No. You don't want me removing your gallbladder, and you don't want them doing your tummy tuck. You want people doing what they were formally trained to do. They tell you, oh, I did so-and-so's fellowship. If the person who trained them if the person who offered them the fellowship is not a plastic surgeon either, then that's the blind leading the blind. It's a lot of those. You know, people get real crazy. They'll be like, oh, I'm starting a fellowship. And they haven't even trained in it themselves. It's ridiculous. You got to watch people out here are crazy nowadays. Sherry says she has a fat grafting question. What's the question? Yay, consult tomorrow. Whoop, whoop. Hey, LaShawn. What hemoglobin levels and BMI do you recommend your patients have? Hemoglobin needs to be in the double digits. It doesn't have to be absolutely perfect, but it actually kind of depends on which surgery you're getting. So I'm a little more lenient with the hemoglobin for a tummy tuck than I would be for liposuction. My BMI cutoff for a tummy tuck is 35 and for liposuction is 33. And if you want in-office awake lipo, it has to be your BMI has to be under 30. Right. Starlene Jenkins Dyke said, absolutely, I work for a plastic surgeon who didn't touch smokers unless you stop for months. We tested patients each visit before surgery and day of. Exactly. Because don't nobody want a bunch of dead tissue. Like, that is a buzzkill. I do all of that work and then everything is dead because you won't stop smoking cigarettes. I don't think so. I don't operate on smokers. And I'm real super ultra selective about operating on diabetics. Can I do surgery after I did one 7 months ago? It depends on what surgery you had, and it depends on what surgery you're trying to get. Do I perform blepharoplasty? Yes. Right. When I do tummy tucks, somebody said my plastic surgeon will absolutely not do more than 2 things at a time. He wouldn't do central abs, only my flank with tummy tuck and MR. Exactly. So my rule of thumb is I won't plan for more than like 4 to 5 hours of surgery at once. So if I'm like this plus this equals 5 hours, that's it. You can't get the next thing. That's another operation. Part of the reason why, first of all, I do all the stuff myself. I throw every stitch, I'm doing the dissection. I do it. So you get to 6 hours and 7 hours. I'm tired. Like, I'm human. I'm not a robot. So I want to do the first part of the procedure with the same amount of excellence and excitement as the end of the procedure. So if we're going 7, 8, 9 hours into the surgery, I'm exhausted by then. I mean, standing in the same place working on something and concentrating and thinking about life and death and all the other stuff for that many hours straight, it's too much. So if the surgery is going to be more than 5 hours, then we're going to break it up. Necrosis is death of the skin and fat of that area. Or if it's a muscle can necrose. Any tissue can necrose. Necrosis means death of the tissue. So when I say dead abdomen, I'm talking about the abdominal wall where the skin and fat live above the muscle. That's what I'm talking about. Right, Kelsey. That's a great point you're making. And people should pay attention to what Kelsey Heredia said. You shouldn't have to worry about how to recognize a dead abdomen. Your doctor should be doing that for you. So one thing that I think social media has done is make people actually think you can watch enough videos to know enough to figure things out, and it's just not that simple. Like, I do a lot of teaching and breaking stuff down for lay people to be able to understand and comprehend, basically so that with something obvious you can save yourself. But there's no way for you to know all the things you need to know from watching YouTube videos about the human body, medicine, and plastic surgery. It's not possible. And you need to, the most important thing for you to do is choose a doctor who seems to have integrity and who seems to treat each patient like a person. Pay attention to reviews of people like, once they got my money, I ain't hear from them. Once I had my surgery, I couldn't get in touch with them, da 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 da. That's a place that you might want to steer clear from. They just want the money. But you shouldn't be trying to figure out how to diagnose anything yourself. Pretty much all you should have to, your responsibility as the patient is to know what bothers you and to tell the truth when you're asked questions about your health. To be completely forthcoming with everything with the doctor. We're not the police. I don't care if you use cocaine. I'm not calling the police to tell on you, but I care if you use it, if it's going to interfere with anesthesia and kill you on the table. So you can tell me whatever. I don't care. I'm not the police. I need you to tell me the truth so that I can make safe decisions in regards to your health. So that's your responsibility. Your responsibility is not to diagnose or come up with a treatment plan. So like people will call my office like, how much is it for a tummy tuck? Well, there's some variables that go with that. And do you even need a tummy tuck? You need to just tell me I don't like my belly. And I say, okay, what is it about your belly you don't like? And based on what you tell me, we come up with a treatment plan that's appropriate for you. It's not for you to decide. People be like, I need a breast lift. And I'm like, your nipples are in perfect position. You actually don't need a breast lift. But they're saggy. They're not saggy. They're deflated. That's two different things. You go and lift those breasts that you have and your nipples are going to be up so high that they'll be peeking out of your bra. I don't need you to tell me which surgery it is. I need you to tell me what bothers you. And then I will help you pick the appropriate surgery for what you have going on. You are not there to diagnose and come up with the treatment plan. You're there to say what bothers you and tell the truth about your medical history when questions are asked. That's what your job is. It's a partnership. If you had gallbladder surgery, I would say you probably want to wait at least 3 months. Hey, mommy. Right. She says some people just don't have common sense, just pay for someone reputable. Yeah, it's amazing to me how people will completely blow off every red flag, and then when something bad happens, they want to go and bash the person on social media talking about, but you did it. Or if someone dies and then their family's trying to go after the doctor, but that woman chose that place on purpose, knowing that other women died before her, and she signed a consent form to let this person who kills people all the time do her surgery. Now the family mad. I mean, they should. I understand the family being mad, but people have to take more responsibility for themselves. A lot of these things that happen to people could be avoided if people weren't desperate or people weren't getting things that maybe they can't afford. You don't have to get it. It's better to be alive and safe than cutting crazy corners and going and playing Russian roulette with your life for a waistline. It's just so bad. Hi, doctor, please, can someone with hernia do liposuction? That is not the best idea to get liposuction while you have a hernia. It depends on where the hernia is. I won't say it's an absolute no, but it's most of the times no. Right. Certainly just no one wants to repair someone else's mess. That's absolutely true. And the thing is, some stuff can't be repaired. It'll never be as good as it was if it was done correctly the first time. Repair surgeries cost more than having fresh tissue. That's normal. It's not the same price. It's just when you get to trying to reconstruct stuff, it's just a different beast. Do you do free consultations? Absolutely not. I have a whole video about why I charge consultation fees. So people ask this all the time, and some people are actually offended that I don't do free consultations. And let me explain why I don't. My time is valuable, and I can't sit all day talking to people who are just thinking about surgery and not generate revenue. I have a practice, I have employees, I have rent and overhead to make the practice go. The people who are greeting you, answering the phone, answering all your questions, rooming you, taking your history, all of that other stuff, they require a paycheck. So I can't work for free. Furthermore, I had 16 years of school and training to learn all these things to be able to give safe surgery to people, and I should be compensated for that. Women will go and make an appointment to get their hair done and have to put down a deposit, but then they get upset when a surgeon asks to be paid for their time. And then there's been a few people like, well, what if I choose to go to another surgeon? Do I get my money back? That's the reason I have a consult fee is if you decide to go to another surgeon. So my time wasn't wasted. It's actually insulting to me when people think that I'm supposed to do consultations for free when they will pay their lash artist a deposit for an appointment and their hairstylist. And not saying that I'm more important than a hairstylist or lash artist, but I'm a surgeon with 16 years of training in the human body. I do safe surgery. I have a great rapport with my patients. They actually meet me. My patients sit with me in the consultation, not a salesperson. And so you got to pay for it. And if you don't think it's worth the $150, then go to one of the doctors that's free. But a lot of those free ones are the ones that's killing folks. So you just be careful, honey. I'm located in Johns Creek, Georgia, which is a suburb of Atlanta. What exactly is a fellowship? Great question. So we have residencies in, there's a bunch of different residencies: internal medicine, family practice, orthopedics, plastic surgery, general surgery, ophthalmology, OBGYN. Okay, so let's say for plastic surgery, our fellowships are microsurgery, hand surgery, craniofacial surgery, cosmetic surgery. Am I leaving thing out there? I think there's some breast and aesthetic fellowships too, but those are the main ones. Out of general surgery, you can do it, and so those fellowships range anywhere from 1 year to 3 years, depending on what the fellowship is in. From like general surgery, you can do a fellowship in cardiothoracic surgery. You can do a fellowship in plastic surgery. You actually can do a fellowship in hand surgery. There's different bariatric surgery. So then that's, doctors who do the weight loss or specialize in the weight loss procedures. So it's subspecialty training is what a fellowship is. So yes, so somebody said it's a fee, but you get to use that towards procedure if you do it. That's true, sort of. So if you decide to book within 7 days of your consult, the $150 will go. My consult fee is $150. The $150 will go towards your surgery. If I consult with you tomorrow and then you're like, I want to think about it, and you call back in 6 months, it don't go towards your surgery. Melissa asked, how long after quitting smoking can you have surgery? I require my patients to quit for 6 weeks. I check your urine at your appointments with me, and I check it the morning of surgery. So if you just slip up and sneak a cigarette on the morning of surgery and it come back positive, surgery is rescheduled. I don't do reconstruction very much anymore. I do it every so often when a person is willing to pay out of pocket because I don't take insurance. Having a heart murmur is not a contraindication to plastic surgery. I would have you have cardiac clearance first and get your cardiologist's blessing. For people who don't have a cardiologist and something comes up that's sort of cardiac, I have a colleague that I send people to make sure the ticker is safe to get them through surgery. What's the most rewarding part of what you do? Oh my God. You know what? People are going to be really surprised by this. The most rewarding part of what I do is actually not surgery at all. So I think because of these videos and some of my life experiences and what I think God actually purposed me for when he created me is helping women with breakthroughs, helping women not be afraid to go after things that they want. I've even helped some women with their marriages. People will come into my office for a consult for surgery. And I mean, this happens all the time. Like literally, what's today? I think it was last Thursday. I think it was Thursday. I had like 5 or 6 consults stacked up in the second half of my day. And I ended up at the office until almost 7 p.m. because every last consult ended up turning into like a therapy session. So God has given me like this amazing ability to be able to see through the facade. And a lot of times women will end up in my office because they're in a phase in their life where they're like, my kids are grown. I've spent my life focusing on everybody else. It's time for me to do something for me. And it's time for me to do some self-care and start paying attention to myself. And the obvious things that people see are physical things. So they'll end up in my office with that sentiment, pointing at their belly, pointing at their boobs, maybe pointing at their face, whatever. And really what is really bothering them is inside. They're at a crossroads in their life and they're like, wait, okay, so my kids are gone. Me and my husband are looking at each other and he get on my nerves now. I don't even know who he is. He don't know who I am because y'all both focused on working and the kids for the last 20 years. You've accomplished everything you had set out to as far as career goals. You got your doctorate degree or 2 master's degrees and you're, a VP or something like that in the company and you're sitting there like, is this it? Like still unfulfilled. And a lot of times people will start thinking, you know what, I'm going to go do something for me because they're in this like state of unrest, and the issue is not their stomach at all. It's something else. And God has given me an ability to like sense that. And so a lot of times in the consults, I'll be talking to the person, and like some random question that seems totally off the wall will come to me to ask them, just based off, I don't know, God drops these things in my spirit. And I will just be like, you know, as for example, it was a lady, was that today or no, it was yesterday. That was yesterday. It was a lady. She wasn't even coming to see me. She was seeing my esthetician. I was sitting up in the front, like talking to my, I got a lot of new staff right now about things. And I see her at the counter, and she was smiling, but she looked sad to me. She was happy. She was projecting. She was trying to project happy. And when I looked at her, her eyes looked like she was more than sad. And I said, "Are you okay?" And she was like, "Oh yeah, I'm okay." I said, "How has your year been going so far?" And her eyes started watering up. I said, "Do you want to talk?" And she was like, "You have time?" I'm like, "I sure do." And I carried her, took her back, and we went into a room, and she unloaded the stuff that was bothering her. And I shared some of the things in my life that I thought would help her see things from a different perspective, and gave her some tools to get through what she was going through. And she left smiling. We hugged. She was like, "I'm so glad I saw you. I'm so glad I came here." You know, like, just people leave my office feeling so much better than they did before, even if they don't get surgery. That is my favorite part of my job. That's my absolute favorite part of my job. And my staff knows, like, patients know, like, I'm always running late, because if God speaks to me and tells me to say something or minister to a lady, I'm going to do it. So my schedule is made so that I can have at least an hour with each person, because I would say 75% of my consults turn into something like what happened with that lady. Like, I'll be talking to them and I'm just like, something else is under there. You know, what is it? And we'll end up talking about whatever thing is they're struggling with. And sometimes they don't even realize what they're struggling with, but I'm able to get it out of them. And then we can get real breakthroughs. Then when you get that lipo or you get that tummy tuck, when the inside is good, you can appreciate it and love it and enjoy it. If you have something going on the inside and you're using surgery to try to make yourself feel better, you end up looking like Lil' Kim. That's how that happens. That's how you take a beautiful woman and turn her into that, is when you ignore her soul. So that's the most rewarding part of what I do. And that's a non-negotiable. My new staff, one of them was like, "Doc, I'm going to need you to get out of that room fast." And I was like, "I'm not going to do it. It's not going to happen. Knock on the door and let me know that I got somebody waiting, and I'll be out in 5 or 10 minutes after that. I'm going to finish my thought. I'm going to finish what I'm doing with this lady. She needs me. This is what she needs this more than she needs surgery." And some of the people, I'm like, "You ain't getting surgery until you see a therapist. We need to deal with this stuff right here." Like that's my thing. Like, I take care of the whole woman. I care about the whole woman. So that's my favorite part of what I do. My second favorite thing is vaginal rejuvenation. My vaginal rejuvenation laser. There's just way too many women not having orgasms, and we all should. I love that laser. And then I like to do lipo and tummy tucks, and I love skin. I love skin. So, how does smoking help lead to necrosis? It's a really wonderful question. So, every time you smoke a cigarette, it makes your blood vessels constrict. Okay, so if your blood vessels are constricted, this is a normal blood vessel, and this is a constricted one. So how much blood is going to get through here as opposed to get through here? So when you have a surgery, in order to heal the area, blood takes healing cells to the area. If the blood vessels are quenched down like this, then the blood can't get there, and then stuff dies. Every cigarette you smoke makes your vessels constrict for 30 minutes. A pack of cigarettes makes your vessels be constricted for 24 hours. Ain't nobody got time for that. You can't heal a surgery without blood flow. So that's how that happens. It's decreased oxygen and blood to the tissue. Exactly. This is the free consultation. So I don't know any surgeons that sit up for an hour and take questions and teach teach you information that you can use with any surgeon. I'm not trying to make everybody be my patient, because everybody is not my patient. I don't want everybody to be my patient. I don't want to do 10 surgeries a day. I don't want to do 10 surgeries a week. Now I will, but I'm trying to create an empire where I don't have to do that. I don't have to labor to live the lifestyle I want. So I do these videos to help equip women to make safe decisions for themselves, regardless of where they go, because I care about women. So this is the free stuff that you get from me. If you try to step into my office and get a one-on-one, you have to pay for that. I don't work for free. My office is not a charity. I do donate to charities, but Darabella Plastic Surgery is not a charity. It's a company with employees who want paychecks. If you get BBL 360, is it necessary to get your inner thighs done? That's a question that varies from person to person. None of it's necessary, but it depends on what your inner thighs look like and what your desires are. Lipedema, that's a different beast. That's kind of, but there's still limits, and that's different. That's not the same as just, yes, I do virtual consults. I would say more than about 60% of my patients come from outside of Georgia. I have patients from all over the world. This year alone, I did 3 people from Afghanistan, 1 person from Kuwait, someone from London, Jamaica, Canada, this year alone. My product line, I ship products all over the country, all over the world. Social media helps your audience be much more vast. I use power-assisted liposuction. Yes, I know about lipedema. But if it's something that sometimes that can be covered by insurance, but I don't take insurance. So if you want it done with insurance, you have to go to a doctor who takes insurance. Phentermine before surgery. Great question. Phentermine before surgery is a no-no. So you need to stop that at least a few weeks before anesthesia. It can kill you when mixed with anesthesia. So don't play with that. Tell the truth. You probably can't find a surgeon's infection rate. You're just going to have to ask them. You probably can't get that. It's not like it's in some database or something like that, which is why it's so important to find an ethical doctor. Because a lot of the things you want to know, how many deaths have they had? There's no place to know that. So you have to keep your ear to the ground and see if you've heard about any deaths. Some of the doctors that have deaths all the time, folks clearly know it and they still go. And that's when I'm like, when stuff happened to you and you knew this person just killed somebody last week, like this summer, it was one of the ladies who died back in June, and I did a video and I wouldn't call it viral by normal standards, but it was viral for me. It was like, I don't know how many it has now, but when I last looked at it about 4 months ago, it had like 60,000 views on it. That's viral for me. Like, I don't have no videos with that many views on it. And Dr. Phil's team saw it, and that's what got me the opportunity to be on that show. But the lady who died in that video, that doctor killed like 4 people in like 3 weeks. Okay, the first person, I get it. She ain't have no warning. But the 3 after her, if somebody died, I'm not saying I'll never have a death, because there's so many things that could cause a person to die. And some of these things are out of your control. And that's why I'm so OCD about making sure the person is as healthy as possible. And I'm super hands-on post-operatively to try to catch stuff. But someone could die, right? Even in my hands, being super careful and trying my hardest to preserve life. If someone died, I probably wouldn't operate for a minute. Like, not forever. I'm not gonna kill my career, but I definitely wouldn't be operating the next day. I definitely wouldn't be operating. I had one lady who she had, this was like in the summer, and it was a liposuction case. I do liposuction more than any other thing. Like, I do more liposuction than any other procedure. And so I'm doing my typical lipo at the surgery center that I normally use. You know, the team is my friends. You know, the anesthetist was somebody I work with all the time. Very smart, very competent. I was doing lipo 360. She started off, whenever I do lipo 360, I do the back first. I start them off, it's called prone, when they're laying on their stomach with their back. I made incision and I started infusing the tumescent solution. I wasn't even working 2 minutes. Like literally nothing had happened yet. I'm just starting to infuse the tumescent solution. And the anesthetist was like, I can't ventilate her, meaning she can't get breaths to go out. Now she's got the tube in, and so she started having issues with ventilating her. After about 2 minutes of her still looking crazy, I was like, flip her. Get the other bed in here. Let's flip her over and get this figured out. We figured it out. It took us about 20 minutes. It was scary. I was like afraid. I'm like, oh my God, oh my God, oh my God, oh my God. Like, oh my God, please. I'm literally standing there praying like, God, please let her be okay. Lord, let us get her, you know, breathing right. Like that. I was literally in there praying and scared to death. Like, what the hell happened? Like, what happened here? We were able to get the tube out. She was fine. She was responsive. We still sent her to the hospital because we were in a surgery center. Had ambulance take her to the hospital. I met her there. We got cardiac workup, pulmonary workup, all of this stuff. I canceled my case for the next day. The lady was alive and well and was like, when can I get my lipo? What you mean you didn't get to do my lipo? I'm like, lady, you were on the table. We were like, I was literally like, oh my God, just please don't let this lady die. Like freaked out. I couldn't operate. I had a case that afternoon that got canceled. I had patients that afternoon. Those got canceled. I took my ass over to the hospital to take care of that woman, and I canceled the surgery for the next day. She didn't die. She was trying to get her lipo again. When can I get back on the schedule is what she was saying. I'm like, lady, we need to figure out why you did that. It turns out it took us a while to figure it out. But it's called a mucus plug. She had a big hunk of mucus in her lungs that clogged up the ET tube and made it so that she couldn't ventilate. Took us forever to figure that out. It shook me up. Now, if she would have died, if I didn't even want to do surgery that day and the next day from that, so then you get these jokers that will kill somebody today, kill somebody next week, kill somebody the week after, and they still operating. Sit down somewhere. Get your mind right. You're clearly doing something, like something ain't right up in here. You need to be reevaluating and reassessing. You don't just be knocking off women left and right. So that's why it's important for you all to take ownership in your own self, because don't turn into the victim after you got hurt if you walk knowingly into a place that hurts people all the time. You're not a victim then. You chose it. People have to take responsibility for themselves to a certain degree. If I've had umbilical surgery already, liposuction not good. No, if you had an umbilical hernia and it's repaired, you're fine for lipo. 3 C-sections, scar tissue causing me some pain at times. Can I still have tummy tuck? Absolutely. Right. All these people trying to get free stuff is why people end up dead. I mean, my contact information, my office number is 678-325-0006. Or you can reach out to my website at www.ederabella.com. And please be patient with us. The responses from my office are a little bit slow right now. I had a complete turnover of my staff, and my new staff is learning and training, and so we're a little bit delayed, but when we get to you, we will love all over you. I appreciate every single person. The fastest way to contact us is to call. We're like about a week behind on the website hits. And if you've hit up our website and didn't get a response, please respond back. It is not because we don't care, because we totally do. But that's why I haven't been live. I had a huge turnover of staff, and it was kind of rough for a minute there, but we're pulling it back together, and that's why I went live tonight. So bear with me. I appreciate everybody, and I look forward to any consults that people want to have with me. How many pounds to your goal weight do you have to be to get a tummy tuck? Within about 10 or 15 pounds of your goal weight is what I recommend. You can wear garments before tummy tucks. There's been 1 or 2 people that I had do that on purpose because they had like the most abnormal rectus diastasis ever, and their bellies were like torpedoes sticking out. And I'm like, let's get your abdominal contents accustomed to living in a smaller space before we do the tummy tuck. But most people, you don't have to do that. I hope all of you have been sharing the video. Yes, God is definitely using me. I feel blessed and grateful that he chose me to do what I do. And I truly believe, like, you know, I used to say before I opened my practice, I want plastic surgery to be a hobby. I want plastic surgery to be a hobby. And I didn't know what else I was planning to do. I just knew, I think God was already preparing me for the fact that this is not my end game. You know, I'll always do plastic surgery, but I will do less of it in the years to come, because he's showing me what he's really got in store for me and what he really wants to do with my life on this earth. And right now, plastic surgery is just nectar to draw women to me. Most of my patients will tell you that the experience they get coming to my office is so much bigger than the surgery that they get. So much bigger. Because I really am into helping women, like, get every blessing God planned for their life. And there are certain things that have to be done in order for you to do that. And I want to help women be brave and stand firm. And I want to help people keep their families together and be good wives and good mothers. Like, that is my favorite part of what I do. And for those of you who are interested in that aspect of what I do, I just started a group. It's called Modern Day Proverbs 31 Woman on Facebook. And in the weeks to come, there will be a lot of activity in it. And I'm going to have, because I started a Bible study in my home. I have it at my house every Sunday. I've been doing it for 9 weeks now. And I've just had so much growth and revelation with that group of women that come together with me every Sunday. And I've had a lot of people interested in being a part of it. But this group that I'm having in my home is very intimate and not something that I don't really want to have a bunch of strangers in my house. But I want to serve, and I want everyone to have the type of breakthrough and revelation that we've had. So what I decided to do, because I've gotten so many people asking, is that I'm probably going to have a Bible study brunch in May. And then I'm going to have a retreat in September, a 3-day retreat. And it's going to be centered around the Proverbs 30, becoming a Proverbs 31 woman. Like, I personally think Proverbs 31 woman is just like the bomb. She's like a real life Claire Huxtable. And I want to be like that. And I know a lot of women want to be like that. So we're going to take 3 days in September and literally study. One day being a good wife or preparing to be a good wife. One day being a good mom. And one day being an entrepreneur. Because the Proverbs 31 woman, honey, she made money. She took care of her house, her man, her kids, and her coin, honey. And that's how I want to be. So stay tuned for that. If you get in that group, you'll be able to see all that stuff. Sometimes I'll go live inside of that group. I might do that at 5:30 in the morning because lately I've started to, before my kids wake up, do my study. And so if I catch something good, I'll go in the group and share it or something like that. So if that's something that you're interested in, just look up Modern Day Proverbs 31 Woman and join. Is there a risk of fat embolism with BBL? Yes. And fat embolism kills. I don't do the O shot. It's probably good. But my vaginal rejuvenation laser made me not have to worry about learning how to do an O shot. That laser is amazing. And that's all I gotta say about that. That laser is why I have Mila Rose. Thank you, Creonce Mac. It's Pretty Skin RX, my skincare line. Do you let people make payments since you don't take insurance? Yes, they can make payments, but you have to be paid in full 30 days before surgery. I don't take insurance because I don't want to. Can a sacral dimple be fixed with plastic surgery? Probably. I need to see it. How do you feel about surgeons recording surgery? I don't have anything against that. Sometimes I'll record pieces of the surgery. I don't live stream in surgery. I don't want to be trying to entertain y'all and do somebody's surgery at the same time. I personally just don't want to do that. So, but I do record segments of some of the surgeries that I do. I don't think there's anything wrong with that. After a C-section, you shouldn't be getting that. So after a C-section, that means you just had a baby. So really, there's nothing you should be getting from a plastic surgery standpoint sooner than 6 months. Nothing. Now, what you should do right after you have a baby is put on a compression garment to hold your stomach in. It'll help close that diastasis up. It'll help that skin shrink down so that you don't get that flap underneath from the C-section. I think that's one of the biggest mistakes women make is have the baby and then their belly's just flapping in the breeze. You need to hold that thing in, bind that sucker up. So that's what you can do in the meantime. And then when you're about 6 months out, you can start thinking about procedure. The deaths were actually, somebody said, what place has so many deaths? It actually was in multiple places. Like, I think somebody died in Germany, a couple in Colombia, a couple in the Dominican Republic, probably somebody in Miami. I don't know. Folks die all over the place. My thoughts on fat transfer to breast. I have a whole video about it, but I don't do it. I'll give you like the down and dirty. After this, I'm going to probably get off because it seems like I've been on for a long time. Yes, it's 12:05. So when you get a mammogram, the radiologist is looking for microcalcifications in the mammogram, in the study, to indicate that there may be a breast cancer there. When you get fat transferred anywhere, all of the fat doesn't live, and the fat that dies calcifies. So when you get fat transferred to your breast, the fat that doesn't live calcifies. And when you get a mammogram, you got calcifications all over the place. And now they're like, can that rule out malignancy? It makes everything confusing. And it's like that forever. The calcifications never go away. So for the rest of your life, every time you get a mammogram, everybody's going to be confused about if they're looking at cancer or dead fat. And to me, that makes no sense to put that type of extra risk and mental anguish into the equation over some breasts. And on top of that, when people get fat transferred to the breast, it'll look so cute at first, and then they watch their breasts dwindle back down to nothing over the next several months. It's just no good. I would never put fat in my breast, so I'm definitely not going to put it in somebody else's. Girl, what comments are you reading? I don't see none of those. I'm not really sure why you don't see them, but I'm reading the comments on this post. Yes, I sell garment. Okay, I'll pin it on my contact info when this is over. Yep, yes, Lori, I have a higher calling. I recognize that. I started noticing that about 1.5 years ago, and right now I'm positive. And I actually finally kind of have a clue of where it's taking me. But I'll just let y'all see as we get there. How do you know if you have a hernia? Because your surgeon will tell you. This is back to people trying to diagnose themselves. You just come and talk about what you want, and the doctor should be capable of discerning all those types of things for you. You have to go and request the group, Shaylee. It's Modern Day Proverbs 31 Woman is the group. Oh, do a live on Sunday. So I probably won't do that because it's a small group, and we've kind of developed a sisterhood and a level of trust with one another. And the reason why we've been able to get so much breakthrough in all of our lives is because we're able to be all the way transparent. And I'm a very transparent person, but I don't tell y'all all of my business because I don't know y'all. So I want all of us who come to this group to feel comfortable saying whatever it is on their heart. So I'm almost positive we will never go live from our personal Sunday sessions. Now, we have talked about possibly having a podcast or something like that. That will be after our personal session, in order to share with other women, because we've recognized that the group of us that have come together, God chose us not by mistake. And we all recognize that something bigger is going to come out of my Sunday Bible study brunch, our Sunday Bible study brunch, because so the actual sessions that we do together will not be live, but there is stuff coming that will be that will help people who are interested in studying with us and studying the same stuff and getting some dialogue, and some of the breakthroughs that we have we can share. That's part of why I put the group there, because I'm trying to figure out exactly how to serve you all without ruining the integrity of our small group. Because in that group, I'm not mentoring anybody. Like, the people that I invited to come there are folks who can pour into me as well. And I'm not saying none of you can't. I don't know you guys. I'm sure some of you can. And sometimes patients come into my office and bless me in the way that I bless others, like, and pour into me and help me. But I can't lay it all on the line with strangers. And so I'm trying to grow right now so that I can get to the next level that God has for me. I need to grow. So that's kind of another reason why I've been quiet, because I've been kind of in a cocoon. God has been doing work on me. And so just stay tuned, because I definitely want to share it. I want everybody to have the clarity that God has been giving me as of late. A fleur-de-lis, does that usually include an MR? If I did it, it does. I don't do any tummy tuck without a muscle repair. Tummy tucks with no muscle repair are stupid to me. You don't have to stop drinking, but it depends on how much you drink. But if it's just like regular drinking, no. I don't drink the night before surgery because it'll make your blood thinner. But yep, a 21-year-old just passed from Colombia a few days ago. Thanks, everybody, on all my skin compliments. Maya Love Deal. Everybody knows how I feel about the DR. You must be new. I would not get surgery there. That's just me. I don't think that's a good place to go. Thank you, Lori. These comments are never ending. I'm gonna have to get off. I don't even know if I can get to the bottom of them. I don't do a lot of BBLs. I don't post pics of BBLs because I don't really like them. And some patients come in and peer pressure me to do them, and then I'll do them. But I don't advertise those because I'm not trying to draw in BBLs. So if that's what you really, really want, I'm probably not the right person. I just don't like them. I got to the end. All right, y'all, I'm about to sign off. I got to wake up early and get all of these kids off to school. And Myla Rose started school today. She had her first day of school. It was hilarious. She made her first piece of artwork that she brought home. I should have brought it in here for y'all to see it. Yeah, there's videos on my page about the DR. It probably doesn't have Dominican Republic in the name. That one lady that died back in June. What did I call that video? If you go to my page, that video will probably come up pretty quickly just because of the number of views it had. I talked about that there. And then I had another video where it was a joint video on my personal page Myla Bennett. That one had to be on my personal page because it was a joint video. And I talked about some of the changes in their policies that they did recently to get people safe. But I have a lot of videos with that. So, okay. So I'm going to go ahead and sign off. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. Oh, one more thing. So I'm having a weight loss challenge. So I don't know if any of you had caught it. In November, I had one. So I am a distributor of products from a company called Total Life Changes. It's a health and wellness company, and they have CBD products. So they have a CBD detox tea, and I'm having a weight loss challenge that's going to start on Monday. So if anybody is interested in being a part of the challenge, I did it in November from November 1st to the 30th, and the winner got cash apped $1,000 on December 1st. So I'm going to do that again, and in mid-February, somebody's going to win $1,000. Whoever loses the most weight. So if you want to be a part of the challenge, then you need to go to the site and buy the products. It is the weight loss tea, the detox tea, and their NutriBurst. I'll put the link to that in my comments as well. So if you want to be a part of that, you need to hurry up and order it because the contest starts on Monday. And that's it. So I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.adarabella.com, or you can call my office at 678-325-0006. Also, I encourage you to check out the Adarabella Facebook and Instagram pages because Adarabella just turned 4 on January 11th. And so we have a lot of medical spa specials until the 31st of January. So check out the Adarabella page. You can see all that stuff. And if you're interested in skincare, go to www.myprettyrx.com and you can check out my products. All right, everybody. Bye.